Hello again, everyone. Welcome back to my channel. And for those of you who's just seeing this for the first time, again, I'm JC. I'm a physiotherapist here in the UK, and I'm doing these vlogs to help other internationally qualified physiotherapists or anyone really who's aspiring to be a physiotherapist here in the UK. And I'm doing mentorship as well with the CSP, or the Chartered Society of Physiotherapists. So if you want some one-to-one coaching, help on your interview preparation, or any help from getting into physiotherapy career in the UK, just search for the mentoring scheme of CSP and look for my name. For today's vlog, it's about the Band 6 community respiratory interview questions. Again, for those of you who's been watching me regarding questions, you all know that it will be dependent on the post or the job role that you're applying, on what will be the questions for the interview. Okay, for example, if it's an acute or hospital-based post, it will be as expected. The questions will be more on the acute setting and the things that are required for that job role. And for those for community as well, so expect questions that are related to the community. And look specifically on the job role, the job description, because the questions will play around there, really. So for today's questions, it's a Band 6 fixed role in community respiratory. And just to emphasize that it's an integrated respiratory team. So the physiotherapist that they were hiring is the post was for either a respiratory nurse or physiotherapist. Okay, so and they are in an integrated team. So when I just asked the questions, I just confirm that this job role, you will be doing diagnostic tests, respiratory assessments like the spirometry, the oxygen assessment, pheno, for example, as well. And still, you will still have those usual pulmonary rehab, home visits, and things like that. So expect that these questions will play around those job role duties and responsibilities of the role. So the questions for, and this is already a given, as I've told you before on my tips. So it's useful that the first question will be more about telling about yourself and how you suit the role. So that was my first question. The second one is what will be your treatment for COPD? The things that you do to manage COPD. I was expecting a question really about COPD, defining COPD, but the question was about how to manage or treat COPD. And they said it's anything that you are actually aware of, and they didn't limit me for just physiotherapy interventions. And then the next question, what is your idea about spirometry? Okay, and then the next one is what do you think is done in an oxygen assessment? And then the next is how do you assess someone with COPD? And then The next one is they ask me what about pulmonary rehab and what are the contraindications for to having pulmonary rehab. The next one is patient. You visited the patient who's unwell. You found a patient unwell when you visited. What will be your action? What will be your assessment? And then they asked me for what are the red flags that you would check in a respiratory assessment. And then they asked me what is my idea about safeguarding, and what is my idea about care closer to home. And the last one was what do I think is what does the NHS need to improve and change. So those are the questions. Again, that's for Band 6 community respiratory physiotherapist role in an integrated respiratory team. Okay, so that's it. Thanks for watching. Those of you who's wanting to know the answers, you might want to do that by my mentoring scheme. Okay, thanks for watching, and hopefully you subscribe as well and like this video. For more videos and suggestions, please let me know in the comments below. Thanks, bye.